just to introduce myself, I'm Emma Perry. I am CEO of an organisation called Bevan. So Bevan is an inclusion, health and wellbeing organisation across West Yorkshire, but delivering lots of services in Bradford. So I was really pleased to be asked to chair the session this afternoon. So obviously this is part of the Core20PLUS5 Learning event that's been running across the week, and there's still sessions to go for the remainder of the week as well. So just a bit of housekeeping to begin with. I know people are kind of still joining, but as you might have noticed, we have started recording the session. So if you don't want to be on the recording, please do turn your cameras off. If you are happy to be on the recording, though, it is lovely to see people's faces, I must say, and certainly for people presenting today, it's always nice to see people rather than initials on a screen. What I would also say is if you could pop yourself on mute, again, whilst the presentations are happening. But having said that, when we come to the Q&A bit, we would really love to hear from you. So please do be thinking about questions as people are presenting, and feel free also to pop questions in the chat as you go along and as you're thinking of them. So we are, I'm just going to do, if we're happy to start, I think again people might join as we go along, but I'll just give you the general information about Core20PLUS5 and an introduction to the week. So we know that across Bradford District and Craven there are significant health inequalities in communities, and obviously that results in huge gaps between how long people will live and the difference in healthy lifestyles and a healthy life expectancy. So the difference is 20 years across the district. So to address this, the Core20PLUS5 was introduced nationally by NHSE. It's an approach to support the reduction of health inequalities. It defines a target population cohort. So the Core20PLUS5 is the Core20+ bit is the population, and the 5 bit is the clinical areas that are focused on. So in Bradford District and Craven, the approach to Core20PLUS5 is to reduce health inequalities for those living in the 20 most deprived areas of the district, and also to support those in the nationally defined plus groups. I'm going to hear much more about those plus groups shortly as we go through the session this afternoon. But again, with those populations, looking at those 5 key clinical areas and priorities. So to do this in Bradford District and Craven, we work closely with our 13 community partnerships, which align with the Core20PLUS5 priorities, linking to locally determined plans to reduce inequalities. Resources have been distributed among the community partnerships proportionately according to need, using the deprivation indices. So the programme has been overseeing the delivery of around 70 projects, which is really impressive, and it involves a really vast range of partners, and again some of those we will hear from this afternoon. So the Core20PLUS5 Learning Week is highlighting what's working well in our approach to Core20PLUS5. It's about sharing learning and celebrating what's been achieved after nearly 3 years of work. So we want to support attendees to apply this learning in your own areas of work. So we really do hope that you take some real pearls of wisdom away with you this afternoon. And also, if you want to find out more about the programme, please look at the other sessions that are remaining across the week. There's one tomorrow and one Friday. And I do believe Sophie is going to post the link to those other sessions in the chat. So we also thought it would be a really good time to air our Core20PLUS5 findings, as the government has just published its 10-year strategy. And the core of this is very much around shifting from treatment to prevention, and also moving care out of hospitals and into communities, which again, a lot of the work that we've done as part of the Core20PLUS5 programme has really been achieving that to date. So there's a lot to learn and take from that. So all very relevant to our local work. And then reducing inequality is something that we hope to embed in our emerging integrated neighbourhood health programme locally. And again, that's going to be looked at across the week as part of the Learning Week. So I just wanted to say a little bit about today's session in particular. So obviously today's session, the kind of title for this is a focus on the plus. So this is about improving healthcare for our most marginalised groups, which is often referred to as inclusion health, but it is the plus bit of the Core 20 plus side of things. So from a personal point of view, as somebody who leads an inclusion health organisation, I think one of the points that's really important for me with this is quite often the plus bit gets conflated with the Core 20 bit. So what I mean by that is the plus bit can get lost around the general health inequalities agenda and approach, and it is a very different need in terms of the groups that the plus side serves. So I think it's a really important session this afternoon, and I'm really pleased that it's been given its own space and its own session across the learning week, because we are talking about people who are usually heard the least, have the least voice, but actually suffer the worst outcomes. So that really is the gist of the session this afternoon. So it's really focused on that plus population. So we're going to hear from projects who've been working with those specific groups. And we're going to be joined by 3 speakers. So we're going to be coming to Jill shortly, who's the Reducing Inequalities Manager, to talk about the overall findings from the Core 20+5 programme around plus populations. And she will also talk a little bit about what those plus populations are, who are within them. And then we're also going to hear from 2 projects. So Chris and Nasmin have joined us from the Good Life Project. So they will talk to us about what they've been doing around that. And then we will be joined by Indy from the Refugee Health Project. So, as I say, just a quick reminder as we're hearing the presentations, do feel free to be thinking about your questions or popping them in the chat. But without further ado, I shall hand over to Jill to talk us through the start of the session. So over to you, Jill.
Okay, thanks, Emma. I think, oh yeah, thank you, Sophie. Sophie's sharing the slides for me. So yes, I'm just going to take a couple of minutes, if that's okay, just to talk about that plus in our Core 20+5 and what that means for us. So last year, RIA led a piece of work to develop the Bradford District and Craven Inclusion Health Needs Assessment, and that identified the population across Bradford District and Craven for our inclusion health groups and also the needs, and made some key recommendations. So we can see from the infographic here on the right hand side that what the inclusion health population looks like. The report estimates that that population is around about 20,000 people. That is likely to be underrepresented. One of the key findings that came from the report was around the data quality and the collection of data, particularly around ethnicity data. So, but the best estimation that we've got is that the population is around about 20,000 people. And we know that there are some groups within that that are overrepresented as well. So we know that the homeless population, for example, in Bradford District is significantly more than the England average. And we also know that the absolute numbers of refugees and asylum seekers that are accommodated in Bradford are the greatest number across the whole of Yorkshire and the Humber. So when we were working with our community partnerships and thinking and supporting them to think about what they wanted to do, what their priorities were, some of them highlighted inclusion health, and they highlighted the groups that we've listed here. So the homeless population, vulnerable migrants, Roma, gypsies and travellers. And when we move on to the next slide, we'll see that there's we've got various interventions that we have in our programme that are working with those groups. It's also worth saying that what we do is, in addition to and adding value to and supporting all the other work that is going on, the great work that is happening with our partners like Bevan, and also the work that is being led by the West Yorkshire ICB. We have, at the West Yorkshire level, we have the Inclusion Health Unit, and in Bradford, we have an Inclusion Health Forum as well. So together, we're kind of taking this work forward. If you wouldn't mind moving on, Sophie, please. Thank you. So very briefly, just thinking about the actual project delivery and the interventions that we have in our programme. Going back to the health needs assessment, that identified some key findings, and I've pulled out here the ones that are pertinent to the groups that our community partnerships wanted to work with. And there were some commonalities through those findings as well. So we can see that mental health issues are common, that they are highlighted here for our homeless population, particularly rough sleepers, and for our asylum seekers and refugees. We also saw, as I've also mentioned, that there was data inaccuracies around data collection and data quality, and we can see that particularly for our Eastern European and Roma populations, and also that population in particular are less likely to engage in some of our preventative interventions. And we also saw that some groups are more likely to identify as having bad or very bad health, and in particular we saw that with our Gypsy and traveller communities. So taking those needs into account, the interventions all address those needs in some shape or form. And one of the key recommendations that came out of the needs assessment was that we work to improve patients' healthcare literacy and trust, and the cultural competency within some of our services as well. So if you look at the interventions that we've got on the infographic in the right-hand side, you can see that we've got projects that deal with advocacy, with health literacy, and some of them that directly address key health issues as well, like mental health and physical health issues. So an example of our advocacy work would be the work that is ongoing with our Gypsy and traveller community. We have work that is focusing on cultural competency within services, and an example of that is the training that we've done for our ESOL tutors, so that to support them to deliver health messaging within the ESOL programme. And we've got some culturally competent and awareness raising projects as well. So for example, we some videos that we've done for the Roma community around cardiovascular health as well. So I'm going to, we've also got projects that are directly intervening with particular key groups, so the vulnerable migrant groups and the homeless people living in supported homeless accommodation, and they are addressing key health issues as well. We're going to hear from a couple of those now. So I'm going to pass back to Emma, thank you, to introduce our next speakers. Thanks very much.
Thanks, Jill. That was really helpful. So I can see we've got our colleagues from Good Life Project online. So I'm going to hand over to you to present what you've been up to in your project. Thank you.
Good afternoon.
Afternoon, we can hear you.
Oh, that's very good. I'm Chris Graham. I run a charity called Safety First Community Training Centre, which is in the centre of Bradford. We're not territorial at all. Everybody comes to Bradford for some reason. Where we've got something called the Good Life Project, which was set up out of the Core20PLUS provision. What we found that at our centre, and we have between 300 and 350 people a week come to our centre. They're all unemployed, very diverse communities. And we found that a lot of people were unable to progress because of their mental health. When you've got poor mental health, it affects everything, as you probably all know. We were very fortunate to get this and to get a really good working team of health practitioners to pull this together a little bit and look at mental health. We work with 10 GP surgeries within Community Partnership 5, within CP5, who refer people to us with mental health issues. The mental health can be anxiety. It impacts on loads of other issues, impacts on employment, impacts on family life. Rather than me talk about it, I'll pass you on to Nasmin, who's our health and wellbeing manager, and she'll give you the lowdown on what we actually do.
Hi everyone. So Chris had just mentioned where we get our referrals from, and we devised a 4-week program to help these mostly South Asian women and men and mostly presenting with stress, anxiety, and depression and panic attacks. So severe that a lot of them not able to actually lead anything in their life, from employment to relationship to family life or anything. So we devised a program, 4-week program, initial consultation with a patient that referred by GPs to us, a little background on their history of what's going on in their life, and majority unemployed patients who are trying very hard to get into work, but because of language barrier, because of skills, because of education, just not able to get to that ladder of employment. Lacking confidence, no self-esteem, and just hopelessness, some even suicidal. So it's been a really challenging journey for us to come across so many patients with variety of issues. And we're very lucky. We have a really good team with holistic therapists, from nurses to offering motivational coaching. So the 4-week program we offered is to look at the state they're in at first. And the first session tends to be consultation with breathing relaxation technique, bringing them to some kind of calmness in their life. And then they go away and practice that for a week. And then the 3-4-week program continues with motivational coaching. And we have 4 constructs to this program, which consists of looking at reducing their stress, giving them the tools and teaching them the skills, what to do when the anxiety kicks in and how to cope. Improving sleep, so looking at sleep hygiene, sleep pattern, their routine, looking at nutrition, what are they eating, how they're eating, when they're eating, how much they're eating, and what foods to eat. So lots of nutrition and diet advice. And the other one is moving more, so encouraging patients to so in working in conjunction with the BEAT program to actually get GPs to help them to signpost them to go join somewhere, to have exercise, or just starting very, very slow and looking at even like 20-minute walk, or just doing the guided breathing techniques that we teach them. It gives them the kind of grounding awareness of where they are in their life and what do they need to do. And for us, it's been a journey for us to see how simple, small things can't be achieved if your mental health isn't right. And once your head is in the right place, you are then going to deal with issues in your life, whether it's looking for a job, whether it's keeping that relationship with your loved ones or your children or your family, or just being well in yourself. And if you've been diagnosed with an illness, for instance, we came across where a majority of our patients, we have over 40 patients who are diagnosed with fibromyalgia. And it's quite a debilitating condition. And to be honest, there isn't much available. So we felt we were offering quite a lot of support to those, particularly women, and majority of them are. We don't have any men with fibro, it's all women. Majority, from older women, 40 plus, again, suffering with menopause symptoms. So we've had real challenging issues here with some women having double whammy with fibromyalgia and menopause. And that's been quite a job for us to try and tweak in additional therapies, for instance, looking at talking therapies and referring them to other places, and sometimes referring them back to their GPs. And my colleagues will talk a little bit more about some of the case studies and some of the numbers that we will discuss here in a minute, to the impact that it's made on the numbers that we've dealt with. So having worked with these patients, we've just worked with about 150 patients, and who each have 4 sessions, some have 5, some have 6. And it is a life-changing game. It is providing a change of mindset, starting somewhere in your life where you feel when your head's in the right place, emotionally you're aligned, you can then look at what do you want to do, what do you want to achieve in your life. It could be as simple as taking a shower, personal hygiene, looking at things like, I'm going to get dressed today, simple things like that some of us who are well enough that take it for granted, but some of these people that have been referred to us just not in a position to do that at the moment. So yeah, so for us, having that kind of input from the 2 nurses that work here, well, we are very privileged to have a team who actually we have 2 nurses who work in the resource team. So we have first aiders on hand all the time, patients who come in who may have very high blood pressure. So the advice and support and guidance that we give to our patients, it makes it a complete unique therapy. So it's not just coming in and having a 30-minute massage. This is a holistic therapy. We look at patients as a whole person. So to see, you know, why is your blood pressure high? Let's have a look. You know, what kind of things can you do to reduce your blood pressure? This is where some of the GPs obviously don't have the time. And, you know, obviously it's not some of their job is to diagnose and prescribe. But this is where we come in, and we find that patients actually take on board, because we're actually guiding them week by week to say, you can do this, and this is how we're going to do this together, and showing them the results, the impact that it has, and the outcome that they see. And it motivates them to actually do, you know, more and more to feel well, and making them realize that this is your health and you have to take responsibility, you know. And that's a real change of behavior we've introduced here, that the responsibility is yours to have good physical and mental health. Okay, so what we want to do, we want to present just 2 or 3 case studies so that you have some idea of how this is changing people's lives. My colleague Nisa is going to say something about those case studies. You can just about see. Yeah.
Hi, I'm Nida. So we deliver most of the sessions, the practical sessions, which include half an hour of usually coaching, and then the actual holistic therapy, which is made up with a Swedish massage, head massage, which include the upper limbs and sometimes full body massage. And that's just to help the ladies to calm the nervous system and to deal with a lot of the anxiety and the depression that they're going through. As well as looking at the 4 constructs on their diet and sleep, we try to physically then help them through the massage to relax that nervous system. So just to give you a brief example of some of the ladies that come through, is the range from what you say from 18 to 65 plus. So it's a quite large area that we do cover. And just to give you an example, we covered things like, for example, we had a 49-year-old lady coming in who was still living with her ex-husband in the same house, going through depression and anxiety, not knowing how to move out of that situation. And through our program, she was able to gain enough confidence to then move out. So before she finished that program, she managed to find a small place to rent and actually have the courage to move away from a psychologically and emotionally abusive husband. She still currently attends on a monthly basis, just to ensure that she's able to then share that experience and ensure that she's still on track. And the results are absolutely outstanding, which is why this project has been absolutely successful for us. We have a lot of ladies coming in with, for example, menopause. So another example would be a 43-year-old lady who was going through early menopause. And at that age, they don't actually know it's the actual menopause kicking in. And she just felt disconnected, you know, not from her family. She had 4 young children under the age of 18. And a relationship was having a bit of a breakdown issue. She just felt so disconnected. With her anxiety and depression, she didn't realize that she actually had started the early menopause. And once she realized that, she then started to take on the board the advice that we had given her, changed her diet, started doing a bit more exercise. And because she knew what she was dealing with, she started to feel more connected then and started managing her anxiety and depression better, and was more emotionally regulated. And the massage then just helped her to kind of go away and not just feel on the edge all the time. Other example would be like a 20-year-old lady that we had who was suffering from unfair treatment at work, and that was causing stress and anxiety. So we get a range of issues coming through, and it was just then helping them to manage more the anxiety and the stress and the depression. And only when that is done, they can then go on to deal with the issue that they are actually facing with. because when they are actually suffering from depression and anxiety and stress, and they're on the edge all the time, they're not able to then deal with the issues effectively and seek out the support they need to actually get to the bottom of their problems. And that is just a couple of examples. I mean, we could go on all day. There are plenty, but that's just a little overview.
Thank you. So we just want to share some feedback we've had from some of the surgeries, just to say what impact this is making on the patients. And Khadija, one of our other therapists, is going to read some of those things. And then I'll add just at the end, and I'm sure there'll be questions at the end.
So just a reminder to put yourselves on mute if you are not presenting. Thank you. Sorry, please carry on.
Hi, my name is Khadija. So I'm just going to go through the feedback that we've received here. We've had a lot of positive feedback from the GPs that we've worked with, and quite at the up to date, we've seen approximately about 150 patients. The GPs have fed back to us from all of the patients that we've seen. They have actually managed to discharge 100 of these patients from themselves. 65% of the patients that we've seen have returned to work or been able to then go and find work and get themselves into jobs after going through our service. We've had feedback from them telling us that 55% have managed to decrease their medication or have come completely off of the medication that they were previously taking. So it's all been very positive. From the patients themselves, we've obviously received feedback that they have left very positive. One of the ladies I saw today actually left. Before she left, she said to me, "You have helped me change my life." And I would just say the impact really with the ladies we have, and even the men, that we see the things that they tell us at the end, from the beginning to the end, we see a total change in a lot of them, where they come back with this positiveness and they're ready to go out there and face challenges that they were previously sort of stopping them from going out and doing the things that we would normally do. The patients left feeling heard, supported, and ready to make lasting changes in their lives. So overall, like I said, the GPs have given us really good feedback, saying that, you know, the service has provided high standards of care, addressing physical, emotional and psychological needs of the patients. And they've come and said that they have seen the benefit directly, and also that how it's reduced the pressure on them in primary care. And we feel that this service obviously would also reduce the actual pressure on the wider healthcare system if it was to obviously continue further. And they've made recommendations saying that they think continued investment in the promotion of holistic therapy it will be highly recommended to maintain and build upon the results that we're already seeing. Thank you.
Thank you. So the question that on the letter that we had was asked us to do 3 key takeaways and learning points. I think for us, the biggest one is I wish we could open it up to everybody in Bradford, but we're not able to because we don't have obviously the funding or the resources. We have patients coming to us from PCN 6, PCN 4 who want to access this therapy, but unfortunately we have to turn them away and say, we're really sorry, but we can't. It's ring fence for this, so there's so many CP5 area and those surgeries. But sadly, so that's one thing. And the other one is actually, which I mentioned earlier, was the fibromyalgia, having more and more women with fibromyalgia and menopause issues. So that's becoming quite apparent that there is a greater need, especially amongst those vulnerable communities with no English or very little education on what is fibromyalgia and what is menopause. And sadly, both those conditions tend to affect women more than men. And there needs to be something more than what we're offering. We're offering a group once a month with no funding, obviously, but the women that are coming to us, we've got about 41 on the register at the moment, and we have 8, 10, 12 every month that come and wanting more of this. And unfortunately, we can only provide for those from CP5. And the other thing that we've noticed that is the massive impact it's had on patients reducing their antidepressants, because they are now able to put things in place, exercise, eat well, sleep well, look after their mental health, and do breathing relaxation techniques, walk and connect with other people. And we have a display in our center that just says how to hack happy hormones. And we actually spell them out. This is how you're going to feel good by doing A, B, C, D, So looking at the future, obviously, with the things that we want to do is provide more sessions, if possible. If that was ever going to be the case, that's why I would be putting forward that more sessions and probably see more patients. And I think overall, we know that there isn't another project like that here. So we're very proud to have what we have here, because it isn't just a massage, it isn't just coaching, it's actually a holistic approach to a person who walks in. So we're not here to fix people's problems, we're here to fix them so they can go away and fix their own problems. This is what we want to do, is to put that person in a calm, relaxed, happy and healthy life, so that they can go away and enjoy that life that they're meant to. So if we can make that difference, we know we can't change the world, but we certainly do change every individual. We change their world when they walk in here. So thank you.
Thanks so much. It's really inspiring work, and thanks for such an engaging presentation. I can see we had a hand up and it's just gone down. Whilst I was seeing if there are other questions, I know there was one in the chat as you were talking from Gavin around access during evenings and weekends, and whether that's something that you currently offer or are thinking of offering as part of your project.
We don't have the resources to be able to do that, unfortunately. We're down to two days a week, Wednesdays and Thursdays. That's sort of resource driven. Yeah. If there were more resources, we might be able to open it up. But weekends and evenings are difficult, as you know. And it tends to be our sort of base is really unemployed people, unemployed plus. So unemployed plus they've got a disability, or unemployed plus they've got English as a second language, or unemployed plus they're over 50. It's those extras that we need to sort of develop, really.
That's great, thank you. Any other questions? I can see one again in the chat from Fiona about, is there any evidence-based link between trauma and fibromyalgia?
It's very
I'm not sure who's confident answering that one.
There is, yes. I mean, I have fibromyalgia myself. I've had fibromyalgia for 20 years. That's why I'm very passionate about providing this support. Been running the NHS group for 12 years or so, on a voluntary basis. But then obviously that's come to an end at some point, because I only work here 2 days a week. But yes, it is very much related, and there's more and more research coming out now. So maybe one day we'll find a cure.
Yeah, absolutely. I think it's really important though, isn't it, that kind of link to trauma, and so much of trauma is carried in people's bodies and manifests in all sorts of ways, doesn't it? So that's obviously, exactly, the body holds a score for trauma. Someone's just put in the chat, I think that's certainly something that resonates. And I know we've got a comment again from Gavin around the link to probation, so that might be something you'd like to pick up on outside of the call this afternoon. And those links to probation are always really helpful around inclusion health work. Yeah, thank you. Anyone else, any questions, comments on the work of the Good Life Project? No, just one little question from myself. It was really helpful there, Chris, where you're describing the types of groups that you're working with. In terms of other inclusion health groups, again, I'm thinking particularly people experiencing homelessness, because they tend to, get missed off lots of things. Is there any either current work underway with that cohort or anything planned?
There's an ad hoc one where we are based in the city centre, which is on the junction of Bank Street and Broadway. We've got quite a few homeless people. We've got a few that regularly sleep outside the door of our fire escape on Broadway. We tend to have them coming in, some people coming in, getting food, getting teas and coffee in our safe space. It's very difficult for many of them to sort of access something that is steady, something that is reliable.
Just a reminder to put people on mute. Thanks, Chris.
Yeah, it's something that's you know, they need structure, and when you're homeless, it is very difficult to stay in any sort of structure because of all the things you have. We have a couple of regulars that come in, but they will only come in when they are at the end of their tether. They'll come in for food and drink, warm clothing, just a bit of respite from outside, but there's no plans at the moment to do anything to formalise that.
Thanks, Chris. Okay, that was really helpful. Well done, the whole team. It just sounds amazing. I think, you know, hearing that feedback from, you know, the people that you're supporting is really powerful, really impactful. So thank you so much, and thanks for sharing that this afternoon with us. Can I check, is Indy on the call from our Refugee Health Project? Hi, Indy. Nice to see you. Are you okay if I hand over to you to talk to us about your project? Oh, you're on mute. I've not said that for a while.
Hi, sorry about that. I haven't unmuted for a while either. Thank you for that, Chris and team. That was really great. Yeah, my name's Indy and I work for the Anchor Project. We're based in BD3 in Bradford, and we received Core20PLUS5 funding. It's taken me a while to get the name right, actually. It's quite confusing when you're not in the health sector. And with that funding, we're working to improve kind of the health outcomes and healthcare for R+ is the vulnerable migrant community, particularly focusing on asylum seekers and refugees. And just apologies, actually, I had planned that my colleague Dinara would be here with me to sort of share this, so it wasn't just me speaking, but unfortunately last minute she hasn't been able to join us, so you just bear with me. So what are we doing with our funding? A bit of background, at Anchor Project we started a drop-in for people seeking asylum and refugees in about 2015, mainly in a response to literally people knocking on the door for support, really. So we're not advice workers, but we do support in lots of different ways, and that's kind of grown over the years and got quite established. But I guess what I would say is over the last, you know, couple of years or so, we've just become more and more aware that we didn't have anybody with any lived experience on our team. So none of us had experienced being forced to leave our homes and move to another country, have no family around. None of us actually knew what it was like to live within the UK asylum system. So when this funding came up, actually, we saw it as an opportunity, and we partnered with Happy Healthy You, who have got a lot of experience in sort of community health stuff, and then we've got the experience with asylum seekers and refugees. So we kind of partnered together to put in an application to employ someone with lived experience. So that's been great. And actually, once we got the funding, we put a lot of time and effort actually into the recruitment process, making sure the advert got out to the right people, making sure we were very accessible and doing information sessions and that kind of thing, so that because I think just because we recognise how important it was to employ the right person in this case, and we ended up with about 20 applications, and I think we did 5 or 6 interviews, and we employed Dinara, who was going to be here, and she's just become part of our team, which has been amazing. So yeah, I guess what, obviously having a worker has given us greater capacity to make connections and to focus on health, which we couldn't do before. And Dinara, having lived experience, means that I think that she can kind of make connections on a different level, really. She understands people's situations and the nuances of it in a different way, which enables her to connect more effectively, I think, and to encourage people and also to challenge people. That's one of the things I've noticed in certain ways as well that would be very difficult for me to do, for example. And we wanted to share 4 kind of main areas where we think we're having an impact, if you like, in terms of health and that community. And we think that, first of all, that's in people's health and well-being now. Then, secondly, in avoiding situations becoming a crisis. And thirdly, being able to support more complex, having the time really to support more complex issues. And the 4th one is about working towards health, improved health for people's future. So in terms of examples, I think with the health and well-being now, I think there's loads of examples, and I would imagine everybody on this call has got loads of examples from certainly some of the names that I can see here. So, but it's interesting how sort of small, specific either signposts or interventions can have really big impacts. So, for example, a woman seeking asylum, mum of 3, joined Dinara's walking group, got her out of the house, it got her connecting with people. I mean, it's the same story, isn't it? Connecting with the environment, just chatting, which lifted her mood. She also found a play park, which was on her journey between nursery and home, so that when she was picking up the kids, she went by the play park, which the kids got to run about, and before they got home to small housing with a lot of stress. So actually just making use of that has had a really big impact on their family. Another young man, prime of his life, and this is a common story, prime of his life, not able to work, here for a long time, feeling really quite depressed and struggling to get out. And Dinara is able to spend time with him, help him look for volunteering. She referred him to Solidaritech, which is a great Bradford organisation. He started volunteering, refurbishing laptops and phones. Was getting out, feeling useful, and then, you know, from that, since then, actually, he's had right to work and been able to get a job. I don't think he'd have been able to get a job without those first steps. So, you know, his health and well-being now is massively impacted, really. Yeah, another family who the wife, a Congolese lady who is married, her husband's got significant disabilities, and she's got an adult son with quite severe mental health issues, and so she's doing a lot of caring and not getting a lot of support. Dinara connected with her. She's able to come to our group now. She gets out to socialise. She comes to the yoga session that Happy Healthy You put on, and it just enables her to now support. It enables her to support her family better. So that's sort of health.
It would be good if you move into
health and well-being now.
Mute. Sorry, India just reminding people to put themselves on mute. Thank you.
Carry on. Yeah. So that's sort of health and well-being now, and then second one was avoiding crisis, and it's always hard to actually sort of define definitely that that's what's happened, other than in specific circumstances. So we did have a time where actually a woman who was 8 months pregnant turned up at our drop-in having slept on a park bench, and Dinara was able to spend time with her to find out what caused that, and enabled, because they'd been kicked out of their house, but that had been because of a lot of misunderstanding and miscommunication, and over quite a lot of time she was able to get to the bottom of that and get that sorted, so they weren't on the streets, sleeping on the streets again. But other things has been mentioned, I think, by Emma and certainly by the Good Life Project, about impacts of trauma. Obviously, within the refugee and asylum seeking community, there's a really high percentage of people suffering the impacts of trauma, and so we've been able to have a session, do some sessions.
We need to check it. You know,
Sorry.
Sorry, thanks. We've still got someone who wasn't on mute. I think they've muted themselves. Go, carry on, Indy. We're all waiting for the next bit.
I'm easily distracted, like I was distracted by the Swedish massage earlier when they were talking about that. I was like, whoa, I need to go on that. So anyway, back to avoiding crisis. Yeah, with trauma, so being able to get somebody to come and run a course, helping people learn how to regulate their nervous system, so that when they're triggered into anxiety or fear or whatever it is, they just learn some basic techniques so they can get on with life, they can get on the bus, they can pick up the kids from school, and not let that spiral into something bigger. And definitely we've had people really benefit from that. The other thing was anger. Dinara really started to realise that anger was quite an issue in the community because of people's histories, and then they're in such difficult situations and limited language often, and that could cause it can cause a lot of problems. One man that we support was actually removed from his GP list because of how he'd spoken to members of staff, and you can kind of see why that happened. But you know, trying to stop that spiraling so they don't keep getting taken off lists meant that she was able to do a little session, get somebody in to do a session about just managing emotions, and particularly strong emotions like anger. So that's sort of ways of trying to avoid getting to crisis points. And then supporting complex issues. I mean, I think, again, I'm sure everybody here has experience of that, but having somebody with that sort of focus and time has allowed her to do that. So for example, the gentleman who was taken off his GP's list, loads of issues in the family. He's got 8 kids, he's got a wife with mental health issues, and she's able to help deal with various things to do with housing, kids and their education, and link them with the immunisation team, who were able to go to their house and sort out immunisations for all the children, get them all up to date, all in one go, you know, that kind of thing. And I noticed Emma said at the beginning, actually, that often these are the group of people who are heard the least with the biggest problems. And actually this man said to Dinara that all the time he'd been in Bradford, no one had listened to him seriously like she had, and that's because she has she's got the remit to do that, and so she's been able to do that, which has been amazing. And then in terms of thinking about future health, this is a really interesting one, because I think it's about helping people connect now to what's available and what's the support that's out there. even though they're dealing with loads of stresses and everything of the here and now, and that's a really delicate balance, I think. And so we've been able to do that in different ways, whether it's getting people to the drop-in, like oral health, active travel, immunisation team, where they can come and it's quite informal, or more specific sessions like a session for women on breast screening, and we can have some lunch and a chat and that kind of thing, or the bigger courses, which might be like the trauma resiliency, just done some pain management courses, healthy eating, those kind of things. But it's helping people to connect in, even though they're dealing with all their stresses now. Yeah, so I think those have been the kind of 4 main areas where we feel like we can have an impact. And like the other group, we were asked to think of 3 learning points, or share 3 learning points. I think ours feel sort of really kind of basic in a way, and yet really important. The first one is just having a worker with lived experience works. I mean, this isn't rocket science, and yet it is, if you like. And so we feel really privileged to have been able to employ Dinara and work together to do that, because it works and it makes a difference. So that's probably our top learning point. The second one was about need for flexibility. So if we're going to support people effectively, we need to be able to support on a range of issues, basically. So I guess if somebody's got issue with their housing or their immigration or whatever, to ignore that and expect them to come to something on oral health is not realistic. And so actually we've got to be able to help with the things that are there and presenting, to be able to then help people access the support for on oral health or cancer screening or whatever. Trying to just push our agenda and ignoring those things doesn't work, and isn't fair on the individual, I think I would go as far to say. And then the third thing is, again, I'm sure something that most of you will experience, is that actually building relationships and gaining trust is absolutely key, and that takes time. And so the fact that this funding is 3-year funding really makes a difference. If it had been 1 year, we'd just be starting to scratch the surface, I think, in terms of building up those relationships, so that this guy can say to somebody like Dinara, actually, I really feel listened to. And if she tried to get him to do an anger management course in the first 2 or 3 months that she'd known him, we probably wouldn't have seen him again, I think. Whereas, you know, a year or 18 months on, then that's when you can start to do that. So those are our 3 takeaways: that having a work with lived experience works, need to be flexible, and not just be your own agenda driven, and that we need time to build relationships and trust.
Thank you so much, Indy. Now, you could say I'm a terrible chair because I've left hardly any time for questions, but on the flip side, I was so fascinated by what both projects were saying, and the whole point of this was about learning from yourselves, and I certainly have learned loads, and I'm sure everybody else on the call has. I mean, you know, if there are any burning questions, please do feel free to kind of, you know, raise your hand and let me know. If not, I'm going to attempt to kind of do a bit of a summary of those sorts of key lessons learned. I think it's both projects have really ably demonstrated the kind of principles around inclusion and those inclusion approaches. I think what I kind of heard from it was around that value of local, of working with local people to find those local solutions. And obviously the other massive thing is around make access easy, and a lot of that comes down to listening to people. As you know, as both projects have said, it's not, access isn't just about physically where you are, but it's about being accessible as people and as you know, an organisation. And I think, you know, the common running theme as well, which, you know, isn't a surprise, I'm sure, to anyone on the call, is that it's the basics of trauma-informed approach. It's relationship building, trust, cultural competency, all of those things that are absolutely key. And I noticed that in the chat, someone's mentioned about upcoming training on trauma-informed practices. So again, that might be absolutely of interest to people on the call as well. So I mean, thank you massively, both organisations, as I say, really, really helpful. Is there any questions that anyone's got, or anything that they want to kind of pop in the chat? If you don't particularly want to raise your hand, I'm just going to do a quick sweep through the room. I can't obviously see everybody in one place because there's quite a number of people on the call. Okay, I'm just going through. Joe, see your hand raised?
Yeah, I'll let Duncan come in as well. I've just popped in the chat that we welcome questions into the RIA inbox if people want connections with others, or if any reflections on today, anything that you want to touch base with the Core20PLUS5 team at the Reducing Inequalities Alliance, then reach out to one of us either through the inbox or the one of us that you most likely happen to know.
Thank you, Joe. Duncan?
Yeah, just really quickly, because there's been so many issues and really sort of quite, I think the two presentations for me have shown how you need like really skilled people to be able to support inclusion health groups that really understand background and lived experience that we were hearing from Indy. It's been essential. In terms of strategically how we support the inclusion health agenda, obviously Emma's organisation, Bevan is absolutely crucial. But the other thing, Jill mentioned it earlier on as well, is that we are trying to support something called an inclusion health network, or a forum that's an advocacy group for different inclusion health groups in Bradford District and Craven. So if anybody wants to be part of that, because that's where we try and share good learning, good practice, and because of the differences in inclusion health groups, that where they come from, their lived experience, the sorts of needs that they have, we try and bring things to the inclusion health groups. So we try and bring support around mental health. If it's early access to cardiovascular disease support, we try and bring that to all those groups in one go. So we bring these issues to that advocacy forum. So if anybody else wants to be involved in that as well, just get in touch with us in the RIA website or via the email address that Sophie put in the chat, and we can carry on the conversation.
Thanks, Duncan. That is really helpful. I'm sure people will be absolutely taking you up on that opportunity. Okay, any more? So just a couple of things. Joe's mentioned that we're going to be publishing our Reach and Impact report later this month. So please do sign up for the newsletter, and that will make sure that you receive the report. Also, when you do get the report, again, think about sharing it around your networks. I think, you know, we don't always appreciate or see, I don't think, in Bradford and West Yorkshire, that it really is, you know, I obviously work around inclusion health kind of, you know, on a national footprint, and it really is special, the services that we have here and the resources that are put into inclusion health. I know there is always more that we can do and can be doing, but it really is a kind of jewel in the crown, I think, in terms of the services, particularly in Bradford, in relation to inclusion health groups. So it should be something, you know, that we are more proud of as well. And it just remains to say, really, if there's no other kind of burning questions, Sophie in the chat has put the link to the Inequalities newsletter. So again, sign up for that and share it as well. Just to do another plug for the other learning events that are happening across the week around our Core20PLUS5 Learning Week. So again, earlier in the Famila says it's a brilliant newsletter, Sophie, so well done. So yeah, just feel free to sign up to the other sessions that are still due to take place this week. And I'm going to say, Joe and Sophie, have I forgotten anything burning there? I hope not. Few. And yeah, again, as I said, be really proud. 70+ projects have done an amazing job. Joe's just popped in the chat. And again, about that hyperlocal provision. My final thoughts on it is a bit of a plea as well, that as we move to neighbourhood approaches, again, this is a really real opportunity to make sure that the plus groups do not get lost in that, and we keep flying the flag around inclusion, health, and people who are most marginalised. And again, as I said at the beginning, least heard. So, bang on 4 o'clock. Thank you so much, everyone. Thanks for everyone who contributed and everybody who attended. It's much appreciated. Enjoy the rest of your week. Bye-bye. Take care all.